see someone and they are so successful, and I knew they could do it. I talked a few weeks ago, a previous mentee, now a professional nurse, she said, yeah, I thought about going back to school and I didn't know if I could do it, but I heard your voice in my head. And I said, what did I say? And she said, you were telling me I could do it if I wanted to. From the time I was a young child, I've always known I was called to be a nurse. I am from Utah, Alabama. I grew up there. Both my parents were born and raised there. My husband's parents grew up in Utah, and so did he. And Utah is a small town. I didn't realize growing up that we were lacking in some resources that other people take for granted. But what we did have was a public health nurse. And I remember when I was a young child seeing that public health nurse and just being in awe of the nurse's professional behaviors and just dedication to keeping us in that small town healthy. I don't know, that just sparked something in me, I think, that sense of responsibility to the well-being of others. I think that may have been when I realized I was meant to be a nurse. I started my nursing career at University of Alabama Hospital in Birmingham. In Atlanta, I worked in the surgical intensive care unit. I also worked at the health department. I saw people with medical conditions and complications and things that I realized even then, is there something we can do to lessen those complications or avoid some of those conditions? And I realized then a nurse could make a difference in all of those things. And when we moved from Georgia here, I thought, what can I do to expand my calling as a nurse? And that's when I found myself in the academic setting and realized then I can make a difference here as an educator. So that's when I went back to school and earned my master's in nursing education, because I realized that that was for me, and that if I could help or influence the nursing students, then they would be nurses who would then make a difference in all those patients that I had seen earlier that I wondered, what could we do about? And so I feel like everything I did kind of brought me to here. The future of nursing in our state and in the nation depends on those who right now are thinking about being a nurse. The most consequential things I've done and that I do is the mentorship and encouragement of others who would be a nurse. Encouraging those students that maybe are still in high school and they think about nursing, the ones in nursing now, novice nurses who've just graduated. Because when I think about myself, I think about the encouragement of someone that made it possible for me. So I've tried to instill confidence in them, and I just want to be in the background cheering them on. So I think that is what I'm most proud of. I know that I have tried to encourage students, and I sometimes can see things in them that they can't see, and I can help them to be confident that they can do what they want to do. That's it. That's probably why I was called to be a nurse.